The first one is in the name of Deputy Frank O'Rourke, and you have 4 minutes to make an initial statement to the House. Deputy O'Rourke.
Thank you, Concordia. I'm delighted to be given this opportunity to speak today on the issue of home care packages as a topical issue. In common with all members in this House, health is a constant issue at my weekly clinics in Kildare North. Access to vital health services is a challenge, waiting lists are increasing, and securing home care for the elderly is a constant struggle for many older people. Most of us like to think that when the time comes, we'll have the means to care for ill or ageing family members who are given the choice would rather be in their own home than in a hospital or nursing home. This is where the home care package comes in, a range of services provided by the HSE to facilitate the care of older people in their own homes, whether it's therapy, home help, respite, transport to and from medical appointments or daycare services. The packages aim to make it easier for people to remain independent for as long as possible. The HSE is a core provision of £324 million for home supports in 2016, and the HSE's National Service Plan for this year provides for a target of 10.4 million home help hours, 15,450 home care packages and 130 intensive home care packages for clients with very complex needs, with a further 60 packages for clients with dementia. While I welcome this provision, unfortunately the reality on the ground for the people accessing these services can be very frustrating and protracted process, as we have discussed earlier. The suspension of home help hours and home care packages in February of this year has had a major impact, and the effects are still there. On a system-wide basis, these cuts have ended up costing dearly, both financially and in terms of patient health. More pressures has been placed on a system already creaking by forcing delays discharging from hospitals, and more people have been readmitted to hospitals due to inadequate supports in the community and in the home. Respite care is another issue. Good home care provision ideally supports both the medical and social model of care, whereby both the carer and the cared for person are supported physically with therapy, respite and home help, and psychologically it should allow the carer to get time and a much needed break. Again, I have been contacted by a number of my constituents this week alone to express their dismay that the provision of respite care at Maynooth Community Care Centre has been restricted and reduced to 2 beds in this entire area. I am awaiting clarification of this via parliamentary question I have submitted, but it would appear that the centre is no longer allowed to use primary care beds for respite. This appears to be totally at variance with government policy and with the commitment given in the programme for government, and it states we will increase funding for home care packages and home help every year. Older people prefer to live in their own homes, and this can be assisted by providing home care packages or home care hours and making their physical environment more suitable for their needs. In Kildare, there has been a decrease of 83,346 home help hours between 2010 and 2015. I would hope that the recent announcement by the Minister for Health on the Government's approval of a revised estimate for the Department of Health will include increased resources for home care services. Could I ask the Minister to be more specific on this issue? Would she also agree that a minimum of 2.2 million extra hours of home help and a further 3,500 home care packages for older people are required? Is that a target that the Government will commit to meeting? May I also raise the issue of intensive home care packages, especially for people with dementia? Most people living with dementia and their families want to have their care at home. Can we step up the provision of intensive home care packages to achieve this? There is now an urgent need for the Minister for Health to deliver as a priority the projected increase in funding for home care packages as included in the programme for government. Thanks, Minister.
Thank you, Deputy Minister. You have 4 minutes.
Thank you. And can I thank the Deputy for raising what is an extremely important issue, as we know from the questions that have already arisen in the PQs today. I want to thank you for raising the issue. As you've rightly said, our population is ageing rapidly, with advances in healthcare leading to a dramatic rise in our older population. Each year, the total number of persons over the age of 65 is growing by about 20,000, so I think we can see what the figures will be in the coming years. There is now a stronger emphasis on home care, on other community service, which provide a greater range of options to avoid admission to acute hospitals, to support early discharges and, where appropriate, to rehabilitate and to re-able patients after periods of particular difficulty. Older people have consistently said that they want to stay in their own homes and communities for as long as possible, and this government is committed to facilitating this, and I certainly, as Minister for Older People, am committed to facilitating this in as much as possible. Home care services are key to achieving this, and the strengthening of home care services is an objective to which this government is committed. The HSE provides a range of community-based services aimed at ensuring older people receive safe, timely and appropriate care and treatment at the lowest level of complexity and as close to home as possible. As you've rightly pointed out, the HSE's National Service Plan for 2016 provides for a target of 10.4 million home help hours to support around 47,800 people. It also provides for 15,450 home care packages and 130 intensive home care packages for clients with complex needs. The further 60 clients with dementia will be supported with co-funding from Atlantic Philanthropies under the Irish National Dementia Strategy. Notwithstanding the significant improvements in the overall economic position that we have seen in recent times, pressures continue to apply across the health service. Services are being stretched by demands from more people, for more hours at times outside of core hours, in the evenings and weekends, all of which cost more. Government has been able to respond for home care in 2016, and as I said to your colleague, the HSE is currently engaging with the local CHOs to establish how that funding can be best divided up and how it can be best spent. Obviously, those who are most in need of it need to receive it first, and I would hope that that would happen as quickly as possible, and I'll be in regular contact with the HSE to see when that funding will be passed down. So if the Deputy wants to keep in touch in that regard. The targets for 2016 will be reviewed in light of these additional resources. There is always more that can be done in these crucial areas, but this represents a step in the right direction. I'm delighted that the Government has been able to respond to the increased demand for the services by providing these additional funds, and can I assure the Deputy that the allocation of these funds in the most appropriate way is the priority for the HSE. Prudent management of available resources is needed as demand for services increases. The HSE will continue to work to apply available resources to most effectively target those with the greatest need and to provide the best possible contribution to the system as a whole. There is no doubt that home care needs more resources than are currently available, and for this reason the Programme for Government commits to increasing funding for home care packages and home help year on year in the coming period. And I can't give the Deputy an exact figure, but obviously whereas I will be looking to get as much funding as physically possible to try and increase the numbers that you have already mentioned. I think respite care, to touch on that, is also significant and of the utmost importance, not just for the individual that needs the care, but also for the carers themselves. The carers are some of the most important people in our society, and I don't think we recognise that possibly enough. And respite is sometimes the only break that they get, and I think we need to see that funding increase also in line with the home care and the home care packages. In relation to the dementia, myself and Minister Harris have met with the Alzheimer's Association. I've met with them several times independently, and we are working with them to see if we can increase the funding and provide specific dementia care packages for people who are suffering.
Thank you, Minister McEntee, for your reply. Deputy, you have 2 minutes.
Thank you, Concordia. And thank you, Minister, for the reply. And I genuinely don't doubt your commitment in this whole area of trying to bring improvements where they're badly needed to the people who need of care, and particularly the elderly. The difficulty is, and you're probably aware of this, as you said earlier in your earlier speech to one of my colleagues, that actually what's happening on the ground is completely different than what maybe is being reported within department circles or within officials. And I would welcome the opportunity, as you have offered, to meet you outside of the chamber to discuss this in detail, because there is a problem with the service provider and the service user. And we're also talking about additional hours, but actually I have 4 cases here, and I could give you a list of 44, no more than you could give me, I'm sure, and other deputies could do the same. We have got a situation in Kildare North where there's people actually have got home help approved, and in the last week officials from the HSE has called to their homes to take that away from them. Now, I'm not coming into the chamber to play theatre with you, Minister. I don't believe in that sort of optic or opportune politics. I believe in working hard for the people that has elected me and represent them to the best of my ability to bring the service that they need. But, for example, there's an elderly lady, she's partially sighted. She's had no home help since February or March, and she was told the other day that she's not going to get it, and if she wants it, she's to pay for it herself. An elderly male at the moment was meant to come home from hospital. He was transferred to another hospital on Friday in Dublin because the home care package wasn't approved for him, which was actually identified and which was charted for him by his consultant. In addition to that, in the rehab hospital in Dunleary, which we know how difficult of a job they have there no more than any medical profession, and the waiting list there, currently I spoke to a constituent on Friday evening who's waiting to be discharged and can't be discharged because the home care package hasn't been approved on that case either. And if you can bear with me, Concordia. And the final one is a couple in their 70s, and she has got dementia and she's incontinent. She needs to be showered on a daily basis, as recommended by the medical professions. Her last shower she gets on a Friday morning at 10 o'clock. She doesn't get another shower until Monday evening at 7 o'clock. He gets 2 breaks on a Monday and Thursday night for 3 hours at a time, and he gets 2 hours for getting chores helped with in the house with home help. And 2 officials arrived from the department last week, from the HSE, like the mafia, and took the time from him. He has lost 2 hours and 2.75 hours. And all I'm just saying, Minister, is we need to get this addressed. These are real issues on the ground. I need your help and I need your support. I need your forbearance, Concordia.
No, I've given you...
I'm asking you to please deal with these issues and help us bring these and get them corrected, because it is a scandal. And these people have contributed to the state and they need to be looked after now.
You've made your point, Minister.
Just to say, Deputy, I suppose this is a priority for me, and I see a huge flaw in the system, and that huge amounts of money are going in to keep people in our hospitals, to keep people in our acute units, where we know that the financial benefits to the HSE, to the department, in actually keeping people at home are massive, but the physical benefits to actually keeping people at home. When people are at home, when they're surrounded by their family, when they have involvement in their community, they naturally get better and they actually live longer, they have happier lives. So, I mean, we have a massive, as you've rightly put it, there is a mammoth task to actually try and flip the manner in which our funding and how it is directed. And unfortunately, you can't just whip the money from underneath the acute services or the hospital services. You have to, I suppose, play the steady game. You have to increase funding in one direction, and as it gradually decreases in the other, where you know you don't need it, that's when we start to see the change. So I think the 5 to 10 year plan for health is where we need to take this. We need to be investing over a long period of time, because this will take time. But in the meantime, the priority is to continue to increase our finances for our home health, for our home care packages, for intensive care packages. That's something I'm working on. It's something I'm actively working on with the advocacy groups, with the support group, with the carers, and with the hospitals as well. So I will work with you on this. I would ask for your support in it, and everybody else's support, because it is an extremely important issue. The number of people over 65 will double in the next number of years, and the number of people over 80 will quadruple. So, you know, we are facing a massive problem if we don't address this now.
Thank you, Minister. Thank you, Deputy. Now,